Hello, this is Dr. Christine Sauer, the founder of Doc Christine. Today, I have the distinct pleasure of interviewing Dr. Rob Rutledge, a radiation oncologist, associate professor of medicine, and the chair and CEO of the Healing and Cancer Foundation. Welcome, Rob. I'm happy to have you on the show.
Thank you so much, Christine. It's wonderful to be here with you. Thank you.
Thank you. And we met before, and I know you're a wonderful person. Just tell our listeners and viewers a little bit about how did you get into becoming an oncologist and then founding the foundation that you're now chairing?
I went to medical school in the University of Toronto in the 1980s, and at that time it was very, very hard news science. And I really felt like I was living in a kind of desert, and I was interested in psychiatry. I was interested in serving people affected by addictions. And then, one of those life-altering moments when the book chooses the reader, the book falls off to your shelf, into your hands. And it was a novel or a book called Love, Medicine, and Miracles by Dr. Bernie Siegel. And Bernie was a Ivy League cancer surgeon, a pioneer in support groups, and was really telling the story of how people could empower themselves on a cancer journey. And I remember actually crying as I was reading that book, knowing that I really, really then knew I wanted to be an oncologist and to run support groups. And I just feel so blessed, heck, it's 30 years later now, and I've, come to organize and lead a charity called the Healing and Cancer Foundation. And, all the dreams of that young medical student has come to fruition many, many years later.
And that's wonderful. And you're still young and in the beginning of your long career, hopefully.
Hopefully as well. Yeah.
Yeah.
But, it's been quite a journey as well, right? So,
yeah.
I read that in the mid to late 80s. And at that point, there really wasn't the science and the perspective. And Bernie was talking about his exceptional cancer patients, the people who did way better than expected, whose tumor shrunk away incredibly, who got through very, very harsh treatments, who outlived their doctor's predictions or spontaneous remission and so on. And Bernie was describing the certain attributes of his exceptional patients. And I really became fascinated with this idea that, how is it that we can manifest, the best possible health outcome? What are the attributes? How can people empower themselves? So it's really been a 30-year journey of trying to discover that. And in those days, there wasn't the kind of the science behind it. There wasn't the neuroscience. There wasn't the prospective studies. There was so little there, but at the same time, in my heart, I knew, I know that those things are true, that we can influence our health, that we can really make a difference. And intuitively, I knew it, but I needed the experience and the life journey, working within the medical system, learning from the thousands of patients that have attended our retreat. So it's really been a life's journey to try to gain this information and then to try to share it back, to kind of garner that information from these wonderful people that I was seeing in the cancer center and the hospital wards, and especially in the weekend retreats. And then how do you package that and present it in a way that's accessible to a wider audience? So that's really been the bigger aspect of my journey.
Now, one question I have to ask you, because from my own experience being a physician in medical school, the aspect of that mental attitude and psychology influences your cancer journey has really in the beginning not been widely accepted. Did you have a lot of roadblocks you had to work against?
Do you know what? It's interesting, and you would think that the other physicians would be hostile to the fact that I had a kind of like a day job, as a radiation oncologist, diagnosis, applying the radiation treatments. 50% of the people that I treat each day are going to be cured of their cancer. So kind of my day job, and absolutely love being a radiation oncologist. But there I was in the evenings reading about the body, mind, spirit connection, running these support groups, et cetera, et cetera. And the physicians are indifferent. The conventionally trained physicians, play an extremely important role in a person's health journey.
Sure.
And
absolutely.
and I endorse the kind of Western medical perspective. It's very scientific based, kind of the benefits, the risk, what the side effects are. It can be an extremely important part of that healing plan. But as you and I are like so on board in terms of integrative, which is the best of the medical system with what you can do to empower yourself, body, mind, and spirit. And how do you marry those two together? And so in the initial years, in indifference, but it's also been fun to look back on this 30-year journey and watch how society and the medical practice has really changed. Like even I felt, yoga was a bit airy-fairy, when I first learning about it 25 years ago. But then there's all these benefits of yoga. And, I thought about it. So it was the late 80s, I was in medical school, and that was very like hard, no science. Make the diagnosis, apply the physical treatment, maximize your chance of cure. And those were the parameters, right? And then suddenly 1990s, quality of life. Imagine that. We should actually think about somebody's side effects and the quality of life that...
I remember when the first quality of life questionnaires came out, and I just loved them. I worked in dermatology then, and it was amazing. You could measure.
Yeah, actually, and think about it, it was important. Yeah. And then there was, then physical medicine in terms of empowerment, that we can change the soup in which the cancer cells are growing. So there was the exercise, and there are certain cancers. I mean, we could have an hour and a half podcast on that by itself, but certain, healthy activities, exercise, diet, sleep, practicing a relaxation technique, all of those things from a kind of very physical perspective have an influence on the body's capacity to unleash the healing potential that's there to help that kind of actually manifest that. So there was the 1990s, maybe early 2000s. And then there was distress screening, right? There's an emotional aspect of cancer, and the emotion influence how the body responds.
Absolutely.
And then, the decade of brain science, explosion of how we understand our brain and how that influences the body's function. Unbelievable what's happening within neuroscience there. And then ultimately, I think we're also in the transition, or maybe have been in the transition for a long time, of bringing a sense of spirituality, the sense of the transcendent into that kind of journey as well. And so society will wake up to that aspect of our healing journey as well. It's happening now as we speak.
And it is so important. And as a brain health coach myself, of course, I'm fascinated by what's going on in the neuropsychiatric, psychological research, in the biochemical research. And we only know maybe 0.5% of what really is going on, if that much.
And agreed. The other one that's, cutting edge for me right now is the microbiome. So the bacteria that are in your gastrointestinal tract have a huge influence on your health and how you absorb the micronutrients and, how your blood sugar spikes and so on. So there's the kind of the physical side of that. So how do we feed the bacteria that feed us? But also there's the psychological and spiritual, because how we hold our nervous system, how we allow our mind to influence our body also affects that microbiome.
And I like the fact how you said that, the way we allow our mind to influence the body, because we have an influence on that. And there is a message of hope there that we both try to pursue. You have an influence in the outcome of your health.
Yes, that's the take. Even that's probably even the starting point is, to flip from being the kind of passive recipient of, what's happening within your life, or the, illness perspective, or what's happening physically, to saying, oh, now I can actually change that. I can actually have an influence. So even that first step of the empowerment, it's like attitude. The first attitude, has a tremendous effect. And then lastly, just to add the last I've talked about spiritual, in some sense that transcends all of what we're talking about. But then there's also something I would call metaphysical, which is that our consciousness has an influence on the physical. So I can't explain this, and I certainly, I'm going beyond the kind of classic Western medicine perspective, but we can, in some sense, influence something that happens physically in a mechanism that I can't explain, that can really influence our health.
And I love that you say that there's so much we still don't know, we can't explain.
Yes.
And for me, I'm fascinated with the history of medicine and metaphysics. And we go back to the old Greeks and before, where the original word diet has meant lifestyle, not just eating in a certain way.
Certain foods, yeah, exactly right.
And it is so fascinating how we get back to what the old philosophers knew, just in a modern way.
Yes, agreed. So that wisdom is there, and I guess that's another takeaway message, and maybe inspiring message, is that we all are blessed with something within us that wants us to heal. There's something that wants to manifest, that wants to have us have a growth, wants to have us, regardless of what may happen within the physical body, that has a huge influence. There's some healing potential within us that wants to manifest so simply understanding that and being able to trust that and tap into that intuition is a very, very powerful medium. So even though I can be talking about this kind of diverse opportunities of healing, really ultimately we each have that guidance within us to tell us what we need to do to help ourselves heal.
Absolutely. And that transforms really the patient person that just waits for the doctor to tell them what to do, into the active part that sees the doctor as a valuable consultant, giving them direction, telling them, if you do that, you have a very good chance of healing, but you have to do more than just lay under the cobalt bomb.
Yes, agreed.
You have to do more than just do the one thing.
Right, agreed. I see that. I mean, it's a piece of the pie. You're like, I was trying to say in some sense that your oncologist or your physician is part of the team.
Right. Healthcare is a team effort.
Yes. And you're the kind of the coach and director and the player on that team.
Right.
But your position's only one piece of a much, much bigger perspective.
I always tell my clients, you are the expert for your body.
Yes.
As physicians and coaches, we can be consultant. We can point you in the direction. We can give you the tools, the treatments that have proven to work. It's up to you to take it.
Yeah, agreed. And that's why the other takeaway is that there's no one best technique. There's no one best diet. There's no one best healing program, right? So, I mean, oftentimes people, tap into watch YouTube videos or so on, and the experts make it sound as if that's the only way or the best way. Well, it may be for a certain percentage of people, but almost as like a smorgasbord of healing potentials, and that you what you resonate with, you draw into your life. Now, it still takes work. You still have to follow the diet or practice the meditation or affirmations or whatever it is that is your healing mechanism, but it's individualized. I think that's really important. There's no one best way.
No, and you have to put together what you get as input from your health consultants, doctors, whatever you use, and then use whatever works for you, as you say.
Agreed.
And, don't believe just one person that tells you that is the way to go, because usually it may work for some, as you said, but not for all.
Yes.
Now, you said you see 50% of the patients you see get healed, which is a wonderful...
Yep.
Yeah, and the other half probably doesn't.
Yeah, the other half, the cancer comes back, and they can live for many years, and sometimes much shorter than that. But it's part of. I mean, expectation is, look, we are human beings. We're all going to die someday,
right?
And so to kind of there's an acceptance piece. It's like, strive, manifest, express your spirit and love in the world, but let go of what you cannot control.
Right. And I love that, because we all have to die, and it is still a very feared issue, but it is a fact of nature. I don't know if I'm dying next minute.
Yes.
And the old Latin said, memento mori, remember to live as if you were dying.
Yes, agreed.
And death has been such a taboo and it shouldn't. And whether we die from cancer, heart disease, or whatever,
Yeah,
we
agreed.
are going through that transition, whether we like it or not.
It's going to happen, and just as you say, recognizing, you may have 2 years to go, or 2 hours to go, or 52 years to go. Life is short and precious, and that's that is the flip side of working as an oncologist, is to recognize that this is very sacred, this life of ours, regardless of what's happening in our lives.
That's a great opportunity to influence people to grow that way too, and I'm glad you're doing that.
Yeah. Well, and it's also been a journey as well, because I can remember, as I've been giving talks for 25 plus years, and being quite worried about talking about death or even recurrence. I was like, if I say that, that's going to increase the kind of anxiety in the audience, and they're not going to like my talk as much, and so on. And then I've also had the experience of the weekend retreats. So we get 50 people with diverse cancer diagnoses. Those are just diagnosed, to those who apparently are going to die in the next few months. And those two people could be sitting beside each other, and you would think that the one has just been diagnosed with very early curable cancer that would scare their socks off. But in fact, it's just the opposite. It demystifies the dying process. The person who's within a couple of months of the end of their life is still very much alive. They're still manifesting. In fact, they can show us the way. They can let their light out and decrease the kind of the tensions and the scares around that. And then I'm also kind of really excited because we're about to present our first ever Skills for Healing Weekend Retreat, but we're actually going to focus on spirituality and cancer. And partly why I'm excited about that is because one of the co-presenters, Reverend David McGinley, is also an expert in near-death experience. And there's a whole kind of world literature on people who've their brains have died, but then their souls have kind of left their bodies, and they have these experiences that they pick up details that they can never know otherwise. But they come back for whatever reason. They're told to come back, and they're no longer scared of dying. And so it's almost as if I wish I could share that perspective with a much wider audience. I wish people understood that we don't need to fear death, that it's a natural transition, and depending on your religious, spiritual beliefs, that I actually think the soul transcends that, and that there's nothing to be feared in the process.
And I couldn't agree more. And that message has to be spread. That has to be demystified. It's a part of life. It's the end of it. And it's not something that we need to fear. Yes. And so many people, when they hear, oh, you've got cancer, they think, oh my God, I'm going to die.
Yes.
And they will, but I'm going to die too. I don't have cancer yet.
Yes.
And I might have it and just not know it. God knows. I don't know.
I'm going to die, but it's maybe been a very, very long point in the future. Yes, and I can understand. I mean, we're culturalized, and it's a natural kind of body, human psyche thing to fear our own death. Yeah. Like there's a programming and a kind of ego perspective. I mean, my teaching, the hope is to be able to integrate that. So it's a natural thing. We don't have to fight off our fear of dying. It's naturally our body's going to feel that. But we can also develop and tap into a higher consciousness that transcends and is able to say, okay, well, that's natural to feel this way, but I can see a bigger perspective. And that's the carpe diem. That's the, let's make the best of this, regardless of how much time I have to live.
And yes, as you said, it is normal to be afraid of something that we don't know. Like nobody really knows what's after death unless you have a very fixed belief about that. But as you said, the transcendence is possible. We can talk about it. We can work through the fear and be courageous in the face. And you probably seen many more people than I ever saw that face their death and help them work through it. And that's wonderful. Now, if somebody is interested in one of those retreats you're offering or learning more about the Healing and Cancer Foundation, where should they go? What's your website? What's your contact address?
Yeah, so it's as easy as healingandcancer.org. So it's a website that leads our charity. There's, I know, 100 plus videos that are free.
Amazing information. I recommend anybody to go there and check it out.
Yeah, so and documentaries, I have like 45-minute documentaries from the previous retreats. And then there are obviously the upcoming events. So in Halifax in late April this year, we're going to offer the Spirituality and Cancer Skills for Healing Weekend Retreat. And so I'm traveling a fair amount as well. So people from different cities will have more webcasts available. So, I mean, it's an opportunity for people to connect, and obviously you can contact us, send us your information.
That is wonderful. So, Rob, that brings us pretty much to the end of our interviews. Thank you so much for being a guest on the show. It is wonderful to talk to you and learn your perspective about healing and cancer, and it's both possible.
Thank you, Christine. It's wonderful to be with you, and I really appreciate your time and this wonderful podcast opportunity. Have a wonderful day, everybody.
You too, everybody. Bye-bye.